All right, well, hello everyone. Welcome to the Indiana Farmers Market Community of Practice September webinar. Today, the Indiana Department of Health is presenting on their food access grant programs. My name is Christina Ferroli, and I'm the Grants Program Coordinator with the Indiana Cooperative Development Center. From the Indiana Department of Health, we have Naima Gardner, who is the SNAP Ed and Nutrition Programs Director in the Division of Nutrition and Physical Activity. There, she works with community partners around the state to improve nutrition environments in a variety of settings. Prior to her role at the Department of Health, Naima was the campaign coordinator for healthy food financing for the American Heart Association, a position that allowed her to work in the policy realm to increase equitable access to healthy food throughout the state. Naima holds a master's in public health from Indiana University, as well as a culinary arts degree from Johnson & Wales University. She worked as a professional chef for several years. Naima is passionate about food and the food systems, particularly ways in which food systems impact public health and social justice. Naima was born and raised in Bloomington, Indiana, go Hoosiers, and currently resides in Indy with her husband and 2 children. Also joining us is Alohna Warren, who is the new food access coordinator with the Division of Nutrition and Physical Activity. She will be administering and monitoring the 3 CDC food access grants. She joined the team from the Children's Hunger Alliance in Columbus, Ohio. During her 10 years with CHA, she served as VP of Strategic Outreach, Data and Compliance Director, and in Warehouse Vendor Management, as well as Project Manager for Grant Deliverables and Process Improvement. She holds an MBA from The Ohio State University, a BS in Education from Ball State, along with PMP and 6 Sigma Green Belt designation. Alohna taught in Tippecanoe School Corporation and Dublin City Schools in Ohio. She has 3 children, of which 2 graduated from Purdue, boiler up, and a 3rd is working on a virtual Purdue degree. Last but not least, we have Megan Paskey, who is the Community Food Systems and Farm to School Coordinator in the Division of Nutrition and Physical Activity. At the Health Department, she works with community partners to strengthen community food systems across the state, focusing on farmers markets and healthcare settings. Additionally, Megan leads the Indiana Grown for Schools Network and the Indiana Farm to School Network to increase the farm to school activities around the state and support local economies. Prior to her role at the Health Department, Megan was a graduate student in Boston with internship experience in food access and child wellness at the City of Boston and Child Fund International. Megan holds a Master of Public Health from Tufts, a Master of Nutrition, focusing in Ag, Food, and Environment from Tufts Friedman School of Nutrition, Science, and Policy. Megan is passionate about the intersection of food access, health outcomes, clinical practices, and policy in both state and federal levels. Megan was raised in Youngstown, Ohio area and currently resides in Indy with her husband and puppy. I ask everyone to please remain muted during the presentation. If you have any questions, type them into the chat. We leave time at the end for a Q&A and discussion. Thank you.
Well, good afternoon, everyone. Thank you, Christina, for that introduction. For those of you who I haven't had the pleasure to meet before, my name is Naima Gardner-Rice. As Christina mentioned, all 3 of us sit in the Division of Nutrition and Physical Activity at the Department of Health. Our larger team focuses on policy systems and environmental strategies to increase consumption of and access to nourishing foods, as well as engagement in and access to physical activity spaces. Our team that I have the pleasure to manage is heavily involved in the SNAP Ed program throughout the state. So many of you may be familiar with us in that capacity. But we also are involved with several larger food access initiatives. Megan and Alohna are going to take the lead on kind of providing an overview of these individual grants. But I'd like to give you sort of a high-level overview and explain kind of why this funding became available and what some of our plans are for it. So Many of you have probably heard either myself or Megan sort of tease that these grants were coming for the last several months. We're very excited to finally be at the point where we can provide you with more details and give you some timelines for when this funding will be available. So the Indiana Department of Health as an agency received a fairly large sum of money from the Center for Disease Control and Prevention in late spring of 2021. This funding was part of overall COVID relief dollars, but very targeted to specifically address health disparities that arose as a result of COVID. Our division was fortunate enough to receive part of that funding, and we have focused our efforts as part of the CDC Health Disparity Grants on really looking at food access, particularly among racial and ethnic minorities and rural populations throughout Indiana. And we are going to be presenting to you today 3 grants that are specifically intended to improve the food access environment for vulnerable populations. And the way that we have kind of connected that back to COVID is both as a preventive measure and a treatment of either acute COVID or long COVID. So one thing that's really important to note as we're going through these presentations is that our approach to everything we do, but particularly with these 3 grants, is very rooted in health equity. Our goal within our division is to make nourishing food accessible to everyone, and to particularly understand how contemporarily and historically oppressed populations sort of disproportionately burden the adverse outcomes that arise as a result to inequitable access to food. So we're happy to answer more questions about how specifically that plays into these grants later on. But just know if you are planning on applying for one of these grants, we will sort of expect you to have a health equity plan as a component to your grant application. The Social Vulnerability Index is something that we're going to use to help sort of filter out the priority of our applicants. It's a tool that created by the CDC to sort of understand the full picture of a community. So there's various levels that you can layer on top of each other to understand what vulnerability looks like within communities. So it takes everything from social and racial, ethnic demographics, but also looks at things like poverty and transportation challenges and things like that to sort of create a fuller picture of a community and what their needs might be. So again, happy to answer any questions about either of these things towards the end of our presentation, but we really wanted to sort of provide that at the outset as sort of the underpinnings for our grants. So as you think through how you might frame projects in each 3 of these grant opportunities, we want to make sure that we're considering health equity at every step of the way. So I think with that, I will turn it over to Alohna.
Thank you. Well, as Naima very well addressed this, the funding is to increase equitable access to healthy food among vulnerable rural populations. The key word here, rural. So it may or may not include ethnic and minority, who are the other, is the focus of our food access and increasing food access capabilities. But in this particular grant, there must be a rural designation. We decided to use, the Indiana Department of Health has decided to use the Health Resources and Services, or HRSA, rural designations, and it breaks it down by county and by tracts. If any of you looked at or opened the proposal for the grant, there is a link in there that takes you to a HRSA document. Within this document, it lists states and their rural designated counties. One of the things that I find, since this is already, the application process is already active, is people are missing the tract part of that document. If you scroll down to the bottom, there are urban counties that are listed, excuse me, that contain rural tracts. The numbers are listed, which sometimes is confusing to folks and they don't necessarily know where that is on a map. I also have a link. If you want that link, put it in the chat or email me. Our contact will be at the end to get the link of if you are in a urban county and are curious if the rural tract applies to you, we do have a link to show you geographically where that lies. And that's helped a lot of people so far. Because the question does come up. Yes, we may seem urban, but there are a lot of rural pockets. And we know that in Indiana, that is definitely the case. The other thing that is coming up and could be considered is there are some communities that are either in a rural county or they're in a rural tract that sits close to a border. And so their program would be servicing other border counties that are listed as rural. So those are a couple of things that people should take into consideration as they look at their program reach. And that is available to use in the application narrative and would be helpful. So we're very open to food access projects and models. We listed out a few to see if people fall under those, to give them ideas. It is not just limited to these, but all kinds of food system models, production, processing, and distribution processes and infrastructures, school-based models, retail-based models. One thing that I want to jump over to real quickly are these milestone dates. As I mentioned, the RFP was released on September 7th, so we are in an active period of application gathering. They are due here in a couple of weeks, so just please make note that if you're interested in this, you've got till 5 o'clock next Friday, October the 8th, to get your application in. I am daily receiving emails for clarification and questions, and we encourage that. So please feel free to do that as well. We are available to answer those questions and inquiries. The awards will be announced on November the 8th. The funding period starts in January 15th and will go to May 31st of 2023. This breaks down those models into some specific examples. I'm pretty excited to say that we have received applications and/or inquiries of folks who are going to apply that hit many of these and in every single one of these buckets. But so whether it's a food council or a community garden idea, excess produce, backpack programs, school pantries, we're seeing it all. And it's farmers markets. We definitely have got some inquiries through that, a mobile market. So we are seeing inquiries throughout the whole variety of possibilities. And again, if you or a partner that you're working with does not fit completely into one of these tidy categories, it's okay. As long as it meets the criteria and the mission of what this money is to and funding is to accomplish, please feel free to reach out and ask us a question or go ahead and apply. So some of the things that we will be looking at, and for the most part, this will be similar throughout the three grants. You can just take a look, like Naima mentioned the social vulnerability index, which as a whole, it gives you a county indication. But if you go to your specific, if you click on the interactive map, and that link is also in the RFP, it gives you specific information to your community and then to the track. And sometimes that changes the conversation. A county may have a different SVI than your particular community. So make sure you review that and include that information in. Needs to be a organization in good standing. I was talking with someone and I could not find their information on a website. It looked like it was closed. So, you know, we'll look in to make sure that everyone is still viable, working in a good standing. Sustainability is something we hope for. For this particular grant, rural populations is one of the qualifications. Who do you work with? Who do you interact with? Who helps support your work? The merit of the program itself as it applies to the criteria mentioned, and of course, as Naima mentioned, this health equity component is very important. There will be some unallowable costs, and I've gotten a few inquiries about that based on people's experience, sometimes with other grants. So we cannot fund research with these CDC funds. Clinical care except as allowed by law. One of the things that has coming up somewhat frequently, furniture or equipment, unless clearly identified in the budget. And so we may need to take a case-by-case conversation as to how close something that might fall into that is really more supplies and is integral in the food access program, as opposed to really creating and funding complete infrastructure for our program. So no legislative activity and regranting. Some of that is pretty familiar. Okay, at this point, I'm going to turn it over to Megan, and she's very familiar and versed with the subject around Produce RX, which is our second food access grant to roll out.
Okay, hi everyone. Yes, our second grant that we are rolling out is the statewide Produce RX pilot grant. This funding is to be used to increase equitable access to healthy food among vulnerable populations. So this does not specifically apply to the rural populations, as Alohna was speaking about earlier. Yeah, this is available to people in all settings. This enables healthcare providers to prescribe vouchers or food boxes for free or discounted produce to their patients living with diet-related conditions or COVID-19 recovery. Our Produce RX programs can improve health outcomes for individuals living with diet-related diseases. This is heavily supported by research, and we were looking to run this statewide pilot project here in Indiana to get Indiana-specific data around the different types of programs being run across the state and the effectiveness of these different models of different programs for different patient populations. It's also very much supported by research, and why we are doing this pilot, that the lack of access to nutritious food is widely known to be a preventable risk factor for chronic disease and infectious diseases such as COVID-19. What this could look like is a variety of things. The RFP will be released 10/25, which is later in October, so about a month from now. We are in the final processes of trying to determine what that model for that RFP is going to be. But it will include a pretty open-ended option of you telling us what your program is and what you need funding capacity for. This funding could support different things such as staff time or supplies needed.
Okay, do you need, oh, did you finish your dates? I'm sorry. Okay.
Yeah, they're saying that they're having a hard time hearing.
Oh, okay.
Sorry,
I'll go
we're
back.
in a conference room, and so our audio is a little.
I'll go back. There we go.
Is this better? Can people hear me better? You're gonna just have to look at me twice here. I'll turn off this video and look at you on Alohna's computer. Okay. Okay, I will recap. Thank you, Christina. Okay, so to recap quickly, we are doing a statewide Produce RX program. This funding is to increase equitable access to healthy food among vulnerable populations. Unlike Alohna's program, that does not specify rural, so this program is open to organizations, clinical partners who all who support populations in any form of geographical setting. So that could be downtown Indianapolis, or it could be in a rural area. This enables healthcare providers to prescribe vouchers for free or discounted produce to patients living with diet-related conditions or COVID-19 recovery. These can also come in the form of produce boxes. There's a lot of different models, if you're familiar with Produce RX, that can be followed here. So things that we've seen in the past are like farmers market vouchers, vouchers to local grocery stores, whether that's a chain grocery store or a locally run grocery store, or like I said, produce boxes that could be provided by medical providers at the time of the appointment. Producer X programs are supported heavily by research, and that includes that they can improve health outcomes for individuals who are living with diet-related diseases. We know that the lack of nutritious food is widely known to be a preventable risk factor for chronic diseases and infectious disease such as COVID-19, which is why this falls under this CDC funding. Oh, there we go. Okay, potential partners. Applicants for this program can be a wide range of people. It could be a local health department, medical or clinical sites, which this could include like an FQHC or a federally qualified health center. Healthcare systems, that can be large statewide healthcare systems or regional serving healthcare systems. Healthcare providers and their partners. I know there's a lot of food banks across the state who partner with clinical providers. That could be a model for applying community-based networks or coalitions, thinking about all of our regional and local health coalitions or community supporting networks that work in this space of food access are more than welcome to apply, as well as academic institutions. Again, one thing to think about, which isn't listed here, but still applies from Alohna's slide, is that research can't be funded. So if academic institutions are applying, we still can't fund research. So the academic institution could be like a partner for the project as far as like maybe being the person to help set up the infrastructure or provide more administrative support to the program. We also know of a few programs around the state who work in that capacity. If you have any questions about if a certain program type would work, or if someone is able to apply, like please just shoot your questions to Alohna and she'll be able to field those and help you work through any of those questions. Similar to Alohna's considerations, the CDC Social Vulnerability Index, as mentioned by Naima, will be a consideration in this grant. Good standing with the state of Indiana is very important. We have to be allowed to give you money. A sustainability plan is really important to us. This pilot program we would love to see be sustainable beyond the funding that we're going to provide. So that's a really important factor that we'd hope to see possibly thought out in your application. Population demographics. Who do you and your partners who are helping you with this program support? If you're an FQHC, describing what populations you serve. If you're a clinical provider, describing the types of populations that you most commonly serve or are on your patient panel. Partners, very similar to population demographics, but as a who are you working with? Who's going to help you in supporting this program, whether it's administratively or providing the food? Maybe I'm partnering with the Binford Farmers Market because that's where my vouchers are going to be redeemed. Program merit, similar to what Alohna said, making sure that we are maintaining fidelity to our funding source. And unallowable costs. Those unallowable costs that Alohna mentioned in that rural food access grant apply to all of these grants that we're talking about today, as they all come from the same parent funding source. In addition to, I guess not in addition, some of the program requirements that we're going to have is that the program is going to have to be disease state treatment. So we're looking for producer X programs in the pediatric or adult populations that are looking with diabetes type 1 and type 2, hypertension, dialysis patients, cancer patients, mental health recovery, prenatal, so pregnancy is considered a disease state for this grant, and those suffering from long COVID or in COVID recovery. So both apply here. Naima mentioned the health equity component that will be required across all of these grants. And specifically for this grant, there will be a food insecurity screening requirement. So making sure that we are collecting data about our patients. We want to be able to help build a narrative around food insecurity and produce RX programs here in the state of Indiana.
Thank you very much for that. Yeah, if you have deeper questions around any of that, Megan and Naima definitely are the ones who have some expertise there. So the last one to roll out is going to be the statewide SNAP matching at farmers markets. It will not be going out until February, but we want to tell you about it now so you can start planning for your summer season next year and for the year after. Farmers markets who are accepting SNAP are immediately eligible. One thing we do want to point out, you can be a current SNAP farmers market, or you may want to start it. So it's okay if you haven't started it yet. This may help you get something going. Once again, we can't overemphasize that we do want to increase food access to these vulnerable populations. We have seen how that's affected these populations during a pandemic. And we do know that these are answers to reducing those risks and vulnerabilities. One thing that research does show is SNAP customers do tend to spend their benefits at farmers markets where there are matching incentives. Why not, right? If they can get there, they're going to get more than they would be spending in other non-SNAP matching programs. The other thing that, of course, we're very thrilled about is it has been shown to increase that fruit and vegetable expenditure. Again, a part of the solution. Important in health prevention. I think you've heard a lot of conversation about that, and recovery to particular diseases, including an infectious disease like COVID. The models here probably are a little more simple and less varied than some of the others grants that we have mentioned. Oh, you know what? Let me just go back very quickly and talk about the dates on that. So as I said, we have decided to release the application. It is not an RFP, it is non-competitive, and I'll talk about that here in a second. But the application opens at that time. And because people start up their markets and their seasons and their programs at different times during the spring going into the summer, we have decided to make it an open and rolling application acceptance period. We will get it out in February, and we expect to start seeing response in February to get stuff started for those who may be opening in March, and then continue forward for those who don't actually start until perhaps May or June or something like that. And the awards will be rolling as well. We will start if the application criteria is met and our team sees the application as fitting some of those considerations and requirements, then we will start awarding those funds. And until we run out, we will continue to do that. We don't expect for that to happen. We think we have a pretty good grasp on what we might see coming in, but that's our goal. So, and then the funding period starts on March the 1st of 2022, and that goes to May 31st of 23. And that's as it stands of now. We may move that funding to February to respond to those early applications, but we're still vetting some of that. And then we'll go on to potential partners. Of course, SNAP eligible farmers markets. Farmers markets that are doing the SNAP program are automatically eligible. But we do see other groups that sponsor SNAP matching. It could be a community-based organization, civic organizations, could be nonprofits. A city or a township may run a program like that, or even a university sponsor. So we're open to anyone that has that SNAP capability. I want to point out, as I said, the non-competitive nature of this. So unlike the other two grants where there will be a review team and a review period, as long as you do meet some of the basic criteria and you have the SNAP eligible program and you're running that program, that automatically gets you in. So you're not competing against funds from others. You're just in by the nature of your program. And again, as we said on the others, the SVI, your standing, sustainability of the program, your population demographics, your partners, your program merit, and be aware and continue to consider those unallowable costs, which were mentioned in the first grant, that we can't be funding some of those unallowable budget requests. And of course, then the health equity component. All right, I know we went through those pretty fast. I'm going to move this to the last slide and open it up because we want to make sure we allow plenty of time for questions and clarification needs. We're completely open for that. So Naima and Christina, if you received any questions or anybody wants to hop off of mute and ask us a question.
I think I did see one with regards to the Produce RX.
Okay.
If it was identified as a pilot program, but would expansion of current Produce RX programs be included or allowable in the RFP or in the application?
And Naima, can I ask you to field that question?
Sure, yeah, and I responded briefly in the chat, but that probably does, it would, you guys benefit for me expanding on that a bit. So it's only a pilot in the sense that the state has never administered a Produce RX program before. So we are piloting the funding of Produce RX programs at the state level. The individual programs themselves do not need to be pilot programs. They can be existing programs that the funding would serve to either sustain or grow. So great question, Michelle.
We did have a question about the dollars. Are these dollars coming through the CARES Act funding?
So I don't think so, Emily. I don't think these are specific CARES Act funding. Where the federal allocation came from, I'm not sure, but I could find out for you if that is relevant.
We do have a question about the Produce RX grant. Could WIC offices apply?
I don't see why not. As we're waiting for more questions to roll in, I did want to just add a couple of points to the SNAP matching. I put this in the chat, but just want to make this really clear. Really, the only stipulation attached to eligibility for the SNAP matching program is that the farmer's market or farm stand, that is a good thing to differentiate, both are eligible. The only thing that's 100% necessary is that you accept SNAP. So you couldn't do a match program with this funding with WIC or senior vouchers. It does have to be SNAP. The other thing I want to mention about the SNAP matching program is that there are still several components. That's the one that we're rolling out last. And there's several details related to that program that we are still sort of teasing out. One of them is how we're going to determine funding level per market. We haven't quite figured that out yet, but I promise you we will by the time we make the application available. And the other thing is that we'll probably continue to work with the statewide nutrition incentives network on this. One thing that we haven't really decided yet is whether or not we're going to sort of expect the program to manage sort of the marketing piece of the matching, or whether we're going to provide any state level materials for marketing. So again, we will work through those details over the next several months. If you have any thoughts or ideas in that regard, please feel free to share them with us. And yeah, encourage more questions.
So basically, if you're a SNAP farmers market, yay, you'll be eligible to apply. If you're not, get started on your application process. We do have several webinars that we did on the topic of SNAP, how to become a SNAP farmers market. So circle back around. Check out the Indiana Farmers Market Community of Practice YouTube channel, Also, Angela Albin at the state level is more than happy to field your questions on becoming a SNAP farmers market. So please look into that so then you can apply for these dollars when they're released. How will the funding announcement be made?
Okay, yeah, good question. So Kathy, I'm assuming what you mean there is how will you know when the applications are open? So the Rural Food Access Grant is open now until October 8th. We can reshare that. I know Christina has already sent it out to the Farmers Market Community of Practice, but if you didn't receive it, we can resend it after this presentation. Generally, when we release funding opportunities, they always go on our website, the Division of Nutrition and Physical Activity, but we also try to do a pretty thorough job of circulating them through all of our various networks. We have a couple of newsletters that they go out in, but you can always, Christina, Christina's a great contact point for this group, I think. So Christina will definitely send them out. In terms of announcing awardees, we usually communicate directly with applicants once we receive the applications. And we don't generally like post publicly who our awardees are, but since this is part of a larger grant, there may be a place where we're working with Purdue Extension on some of the coordination and evaluation work related to this larger CDC grant. So we may have some public facing spaces where we will announce awardees.
Yeah, that was a big question. Also, just to follow up what Naima said, the Indiana Farmers Market Community of Practice, we're working on a website. We're in the development stages and we will be launching hopefully in October. And we will be able to highlight and make notices available of anything that's happening. And we'll also have like a little monthly communique, very short, to keep people up to date. We'll be collecting emails to be on the list to keep people in the know. So yeah, we'll be a good contact for that. There was a question, Naima, what exactly does the SNAP grant funds be applied toward? I guess did you see that question, Naima?
Yeah, and I'll try to answer based on what I think you mean. But Joyce, if I'm not getting at what you're asking, please let me know. So the SNAP matching dollars will be exclusively to match SNAP benefits. So I think that generally it's a 20 to 20 match. So $20 of SNAP benefits will be matched with $20 of cash, making your spending power $40. If I do think that we would be willing to fund and some administrative support for a grant like that, and some marketing kind of things if we determine that we're not going to supply that at the state level. But again, some of that really does still need to be teased out by us internally. And once we make once we open the application in February, we'll make sure all of those details are very, very clear. Joyce, did that answer your question or did I miss the mark on that?
I think that was fine.
Okay.
I'll let you know if we have any more. Thank you.
Naima, there was a question about did you see Michelle's question? Can you?
Yeah, and Michelle, I'm not sure I understand what you mean. Would you mind expanding a little?
Yeah, can you hear me okay?
Yeah.
Yes.
Yeah, I'm just thinking, you know, throughout the state, we know that SNAP matching programs, they operate very differently. And here in Indianapolis, you know, ours is more county-wide. So we have the health department that operates Fresh Bucks, which is the SNAP matching program in Indy. So what if there's a new market that starts in Indy and they're not aware of Fresh Bucks and they apply for an application? To address that confusion, we obviously don't want one single farmers market to be applying for a SNAP matching program when there's already one happening in the county. And I, you know, I think of Fort Wayne as well, you know, so there's already organizations that coordinate that. Will there be some sort of like referral to be like, hey, this organization actually runs your SNAP matching program in your county or your region, you know, get into their into that funding so that there can be allocations towards your actual farmers market.
Yeah, thank you for that. So I think the short answer is yes. We will be aware. To my knowledge, though, outside of Marion and Allen, there are not very many SNAP matching programs that are being administered at the city or county level. But we will make sure if we receive applications from Marion County and or Allen County, we can most certainly coordinate with county city level folks to make sure that we're not kind of duplicating efforts unnecessarily.
Thank you. There is a question about the produce RX. Are there limits on how much you can apply for? Have you determined those yet?
Not specifically. There will be an award ceiling though. And we will make that clear when we release the RFP for that program in November. But Alohna, your knowledge on this might be a little bit fresher than mine. Were we talking about having a ceiling of $20,000?
You mean on the Produce RX?
Yeah.
I think we did have some internal possibility conversations around that.
Mm-hmm.
We didn't want to completely nail it down until we got deeper into the detail and the model that we pick and stuff like that. So.
Yeah, and I think that, Allison, the thing, we may leave it a little bit open-ended and kind of take it on a case-by-case basis. One thing I can envision is if a coalition or something applies for funding to manage maybe more than one Produce RX program, that the ceiling might be quite a bit higher for organizations that are trying to implement several different Produce RX programs. So our approach to all of this is we do have a general ceiling on individual awards, but we do also consider each application on a case-by-case basis.
Yes, and I would expand on the rural food access. That's exactly what we are encountering. We internally thought of a range of 20,000 at the higher level, but we purposely didn't put it in to encourage people to apply whose programs might fall a little below that or the bottom side of that potential range, or people who might fall outside on the upside, but once we dig into the detail of their program idea, it might merit consideration. So, and that has produced a lot of really good conversations. So that part has been good.
Or some conversation around, like, if you could only have 20,000 of your $100,000 you asked for, like, what would you use it for?
Yeah.
Really trying to understand maybe like what the greatest need is and how our division might help, and this funding might help to address that.
Yeah, it may enter into some priority budgeting of the, like, what would you pick as your priority, your greatest need within that? So exactly.
So thank you for clarifying that. So basically go ahead and apply, have your budget, whatever for your project, and then you will have a conversation with them as to if it can be all funded or what parts are integral that would be funded. But go ahead, please, and please apply for the food access grants. There is a question regarding the SNAP matching. Will the SNAP matching dollars cover the cost of tokens or checks used for the program?
Yes.
Fantastic. There was a question about, we already discussed the limits, and that was with the Rural Food Access Grant. So again, just go ahead and apply, or email or call Alohna. She'll more than gladly walk you through a conversation about what you want to apply for, your dollar amount. I will be sharing these slides in a follow-up email with a post-event or post-webinar survey. So you all will be getting the slides with the timelines on them. So thank you for sharing those. Just a quick, when will the Produce RX grant open?
I believe our date on that one is November 1st, right, guys?
Yes, that the release, why do I have 10/25? That's probably the pre-release, I'm thinking, to the website perhaps. I do have a 10/25 release on that with the application due on November 24th before we get into the Thanksgiving holiday.
I believe it will be open to the public on November 1st.
Okay,
though.
so
I think
that was a pre-release. Okay, sorry about that.
And all the RFPs or applications are on your website already. Well, 2 of them are already. So
Yeah,
please check.
they'll always appear there for sure.
Do we have any other questions?
When you say on the website, are you talking about the Indiana Department of Health website?
Yes.
Do you mind
Thank you.
putting the address in the chat box, please?
Yep, will do.
Thank you.
These have been some really great questions for us as well. What else do people want to know to help forward their potential application? And if not questions, we're open for comments as well.
Yes, please. This would be an excellent time if you have a question and you'd like clarification, because we all learn as we ask questions and work towards the answers or solutions.
Hi there. This is Vivian with the Elephant Gardens. We're in regards to the rural grant. We're not rural. We're definitely in the city of Indianapolis. However, we have a rural partner, and we grow out there through 1/8 acre. And I guess I'm trying to figure out if this is something that maybe my partners could apply for. And before I pass on that information, I really kind of want to know again, I don't think I have a proper understanding of exactly what this rural grant is intended to do, or what it covers. You mentioned something about, I think you mentioned something about it doesn't cover infrastructure or something like that, but I could have heard that wrong. If you could just give me some clarity on the rural grant.
Naima, do you want to field that?
I'll start, and then anything I miss, feel free to hop in. I think, Vivian, I think that yes, potentially your rural partners could definitely be eligible. This is it's a little tricky for us to give you too many like concrete details about this, because we've left this sort of intentionally pretty open-ended. We really want rural communities to kind of define for themselves what their own challenges and solutions might be. So really the parameters around rural, like Alohna said, we are using the HRSA rural designations. Alohna, maybe if you could drop that link into the chat, that might be helpful for folks.
Okay.
So the HRSA rural designations define entire counties that are considered rural, but also down to the census tract level. We are considering funding organizations as long as the service area is in one of those rural designations, even if the organization itself is in a more urban situation. In terms of the sort of high level intent, is really just to improve the food access environment in rural settings. So we, and really Alohna has been great at talking to potential applicants about this. We're happy, even if your rural partner kind of has maybe a few ideas, but they're really sort of unsure which way to go with it, and they want to talk through some of that with us, we encourage people to reach out to us as they're putting their application together. One other thing that I want to mention about this grant that I don't think Alohna mentioned, we're kind of trying out for the first time a new way of grant making with this. I don't know if anybody on the call has looked at the application yet, but it's very brief. It's a very brief letter of intent, just kind of describing to us what your project proposal is, what it's intended to do, and sketching out sort of a high level budget. but we're really going to be basing our funding decisions on face-to-face virtual conversations with all of the applicants. So we're going to schedule Zoom calls with folks to really get a sense of who they are, the community they serve, and how their project will improve the food access environment for their rural communities. Vivian, did that answer your question, or is there something I'm still not getting at in terms of the rural food access grant?
No, you made it clear. Thank you. I appreciate that.
Yeah, sure thing. I'm seeing, what are the qualifications?
Yeah, I think people are still confused about the rural, the designation, the greater than 0.5 index.
Okay, so those two things are different. So the social vulnerability index and the rural designation, those are two different sort of categorical classifications. The social vulnerability index is going to help us sort of prioritize the need of our applicants, but it doesn't disqualify anyone. The HRSA rural designations is a qualifying factor for the rural food access grants. But like I said, there is some wiggle room if, for example, an organization is located in an urban setting, but they do have programming that's specifically targeted towards populations that do meet that rural designation. So I hope that clarifies things. I know it can be a little tricky. We kind of decided as an agency that those were the rural designations that we were going to use. So everybody that's being funded through this pot of CDC dollars is using those same HRSA rural designations to define rural.
Okay, thank you. And if you have any questions, email Alohna. I know she answered mine. We do have a question about the SNAP program. I just lost, hold on a second.
I saw from Anne, I saw that. Anne,
Yeah.
that's such a great question. And it's so funny that you asked me that, because I just started an email thread this morning with some internal people about this. This is something that we're still trying to work out. Traditionally, as I'm sure you're very aware, we do a cost reimbursement structure with our granting at the Department of Health. But I don't think that's a very ideal structure for this type of grant making. So I am going to look into some alternative possibilities. So I guess the short answer that is kind of TBD on that. But we will, I'm going to do everything I can to make these sort of upfront disbursements and not a cost reimbursement situation. And also, Anne, I know I owe you an email, and I'm really glad that you put a message in because it's sparking my memory. So I'll email you right now.
Yeah, I think that the easier format, the more simple you can make them, Naima, the easier people will be able to, come on board with. So thank you.
And I want to make it clear that I can't make any promises in that regard. That this is an area that I have very little control over, but I'm going to try to, do what I can to kind of massage our processes and procedures to make it a little different. So more to come on that.
One thing I would like to add is, Christina, I do encourage people to do call and have emails or send emails if they're intimidated by any of the questions or confused by any of the questions. We don't want people not to apply because of that kind of a barrier. That's been really emphasized to the team, and that's important to us because some people don't necessarily have a grant writer on staff, and but still would qualify. So feel free to ask any question. As they say, there's no dumb question. And I've enjoyed the conversations with folks and hearing about their programs and their specific questions. And in every single case, we've been either able to help them with rural designations or specific qualifications, or if it is too much in an infrastructure equipment, we have been able to find how to reroute that closer to the program so that they're still able to apply. So that part, we are here to help. So please don't be shy. Feel free to reach out and help us with any of those thoughts or questions throughout any of these grants.
Thank you, Alohna. And I will share the information that was made available in the chat in the follow-up email. So everyone will have access to that too.
Yeah, one is the rural designation document and the other is this, once you find the census tract number at the bottom is a map that helps you get to, well, where is that? I will tell you that the census tract numbers are very long. They stand for state and county. They mean different things. And when you look at the tract map, sometimes it takes a portion of that number to identify the area. So you may have a 7-digit number, but only 4 numbers on your map, but you'll start seeing the correlation when you look at them. And if you can't put those together, give me a call. I've been looking at them a lot. So,
well, I think we're coming up to 1 o'clock. If anyone has any final questions, unmute. Feel free to ask. And again, please. Oh, Michelle Shippey. Yes, definitely. She made a suggestion that we try to work on collaborations on these 3 grant matching programs. So for sure, especially on Produce RX or SNAP matching, reach out to your fellow colleagues who are working in this area in your counties. Reach out to Alohna also if you need some connections, and Naima, because they'll be able to help make those connections as well. So please look for collaborations. Those make stronger projects. So thank you, everyone. Go ahead.
Could I just throw a last comment in? If you want to channel most of those questions, I promise you I'm new, but I definitely go to Naima and Megan about this. She's smiling because I come by her desk 3,000 times a day. So I can help coordinate those questions and take some of that load off of Naima and Megan, but I am referencing them for their expertise and experience for sure. So just to let you know.
Fantastic. So again, Alana's the point person. And I think I don't see anything else new, ladies. So I thank you. It's been a wonderful webinar. And yes, we will provide contact information in the follow-up email. I'll send it out in a couple of days so I make sure I have everything included. If anybody is in Delaware, would like to collaborate. So thank you everyone for participating, and thank you to Alohna, Naima, and Megan, and we'll see you in October.
Thank you.
Thank you. Bye.
Bye.